So what is Morpheus and how does it work? Morpheus8 is a radiofrequency-based microneedling treatment where we have needles that are stamped into the skin and make intentional little microchannels in the skin. And while it's in the skin, going below the surface, we're going to release radiofrequency at the layer of the skin where the fibroblasts reside. And the fibroblasts produce elastin, fibrin, and collagen. All three of those things are the structure of our skin. So when we can stimulate that cell, we're going to rebuild the structure of the skin. That is going to help lift the skin. It's going to help tighten up wrinkles, and we can also do fat reduction to go deep enough to get to the fat layer. So we reduce that fat right underneath the submentum or even along those tricky jowl areas. What areas would we treat with Morpheus? Most people treat the face and neck ideally. And so that's going to be forehead, cheeks, jowls, chin. We can do above the lips to help with those little pucker lines that people develop. Under the chin, neck, we can do hands. I've done the backs of arms. We can do booties, inner thighs, outer thighs, pretty much anywhere where we have loose skin that we want to tighten up. Does this treatment hurt? That's a difficult question for any one of us nurses to answer. Everyone's different. It is uncomfortable. You know, we do have needles that we're injecting into the skin. We can feel that. We do numbing cream. We can do pain management with Tylenol and other options there. Some people tolerate it really, really well. Other people, it's a little bit more difficult, but I am always there for you through the whole thing. I'll help walk you through it. You're not going to be doing it alone. So how many sessions do people generally need to do? The minimum is 3. We can treat with 1. A treatment is 3. And so we do that 6 weeks apart. And everyone's a little bit different. If we're younger or if we've done other treatments to help with collagen boosting, you might be good at 3. If you're older and you have experienced more collagen loss as a result of having more years under your belt, or if you haven't necessarily done any other treatments that are going to stimulate collagen, you might need more, 4, 5, possibly even as much as 6. And then obviously there's always maintenance. So anything that we do in office today or, over the course of a series of treatments is not permanent in the sense of we continue getting older and we continue losing that collagen. So we'd like to do maintenance to help balance out that loss that's happening. So we do the series of 3, 4, 6, whatever you might end up needing. The maintenance, we're looking at usually doing another 1 every 6 months to 12 months, depending on the individual. Morpheus8 is a bit different than other things that are on the market in the sense of if we're talking about radiofrequency treatment specifically, a lot of them are going to be on the surface of the skin and working their way down, which is still great. What's different about microneedling with radiofrequency is that when those needles go in, that radiofrequency is going to be delivered right at the layer of skin where we want to activate any sort of change. We release the radiofrequency right there at the source and it penetrates out instead of needing to penetrate down through all the layers of the skin. There are other options with microneedling, not just with a machine. There's microneedling pen. That's a little bit different. It's going to work only on the inflammatory response because we don't have any radiofrequency with it. And instead of the nice clean lines punching through from those needles, it's a little handheld device and it's going to penetrate like this as we move it around, right? So we're gonna cause an inflammatory response on the surface. It's a little less intentional as far as, nice clean columns. Still a great result. It's especially better for younger patients who don't have as much collagen loss and therefore don't have as far to go. They might not need something as aggressive as Morpheus8. Microneedling with the pen is a great substitute